Started, huh? Okay. Hi, everyone. Dr. Jagadish here. Very interesting opportunity from ICMR, Indian Council of Medical Research, to help you students during your first professional, second, and third professional years to do some research, to get some stipend, as well as to build your CV, which is also an important thing for you to do so that independently, when you are a doctor, you can do your own research, carry out your own research. So I've got 30 minutes over here and I can answer any questions or concerns that you may have, regarding how to apply for this. What is it? How does it help you? What project you should select? How should you go about it? All of that can be done over here. ICMR and I go back a long way. I have, worked with ICMR on various projects. I did a 5-year long project with ICMR that was funded for screening of hearing loss with St. John's Medical College, where we screened a lot of school children. And I've also been closely associated with ICMR at the moment for some innovation programs. There is a CLIMB program by ICMR that is running with IIT Kharagpur and now going to start with IIT Kanpur and IIT Hyderabad. So a lot of these things, are there with ICMR. So Dr. Ishan is asking post MBBS options. So Dr. Ishan, post MBBS, there are a lot of options. Today's topic is ICMR STS while you're your undergraduate. So right now, this session is relevant for people between first year MBBS and final year MBBS. Interns also cannot apply. And after that also, this particular program is not going to be of much use. But yeah, post MBBS, there are a lot of things that you can do. If you check the ICMR website, there are certain fellowships for post MBBS also. Okay, so I'm just opening their prospectus, and there are certain studies that fellowships over here that you can do, especially this MD, MS, DM thesis support, and there is an MD, MS, PhD program, and there's non-medical fellowship for PhD, NET, and short-term and long-term fellowships. Since we are on this topic, these are some things that you can do for post MBBS, where you get stipend up to 75,000 to 90,000, depending upon what you choose. You can go through this particular prospectus. Sir, can I do STS research outside my college? No, Preeti, this STS is supposed to be done only within that particular college, and the guide also has to be a full-time employee of that medical college, and you have to be that student of that particular guide. You don't have to be in the same department. You can do it in any field. There are a lot of fields in which you can do, like if you see this particular area over here, from biotechnology, clinical psychology, a lot of these things you can pick. It doesn't have to be your current class, but you have to be from the same college. Ujjwal Mishra, can foreign students from Nepal participate in ICMR? See, there is one particular point over here that says who can apply, and they basically say if you have OCI status or NRI status, you can apply. But if you're not having the OCI or NRI status, you will not be able to apply for this. They have mentioned that somewhere here. Students who are holding OCI cards, PIO cards, and NRI studying in an Indian medical or dental college, which is NMC and DCI recognized. Only those. So if you fit into that, you can. If you are not, then this particular ICMR STS program will not be there for you. Yes, Vagela, BDS students can apply. This is for MBBS and BDS students between their first professional year and fourth professional year. About 2,000 students are going to be awarded this short-term student program. That's what STS stands for, short-term studentship, where you can spend 2 months between each holiday. So between first and second year MBBS or first and second year BDS, you get 2 months summer vacation. There you have to do concept note submission. Then in the second year, you get 2 months holiday where you will do data collection. And the final 2 years, you do the analysis and submit the reports. So you can do it. What are the odds of getting selected? YG1234. I would say the odds of getting selected are very high because just the number of people who can complete this submission process itself will be very hard. Many people are going to give up along the way. The one who has the resilience to go through the ICMR application process, upload 1 MB, 0.5 MB files, and be there after all of that internet issues and submit, most likely will get it. Of course, if you have a good project, your odds are obviously going to be high. If you're just going to submit something for the sake of stipend, I don't think it is going to be high. Sachin Sharma, third year. So third year, yes, there are two applications, both for one is for first year and second year. So this short term is for first year and second year, but there is another call on the same website only for third year STS. What is the difference, Sachin? Is this is 6 months and 2 months between first year and second year and third year and final year. Whereas the third year one is just a 2 month program that you will finish within your third year itself, and that has a separate application, but your stipend is 30,000. Here it is 60,000 divided between three milestones: 15,000, 15,000, and 30,000 at the end of the submission. So you can apply for third year. Kiran, who will guide us? You are supposed to have a guide. So in your application process, someone from your medical or dental college has to be a guide, and that guide cannot be a guide for any other student for that particular term. It has to be a unique guide, and that guide will be able to tell you what you need to work on and will be the person you will report to going forward. So finding a guide is a very important part of this application process. If you don't have a guide from your own college, you will not be able to apply. Arjun is saying, mentor JC. I am not part of any medical college, guys. I can guide you, but this is not going to be accepted by ICMR. So I can only give you my, this kind of conversational information if it helps, but you will not be eligible for ICMR stipend. Systema creativitas. I am in second year. How can I apply? This is the thing I like about ICMR. If you have the research instinct, you will be able to apply. You have to search everything. Google search ICMR. In ICMR, you have to look for these words, okay? I like how they create so many confusing words to keep our research alive. First thing you have to find is DHR. What is DHR? Department of Health Resources. In Department of Health Resources, you have to find HRD. What is HRD? It is Human Resource Development for Health Resources. And in DHR, you have to go to EPMS. Yes, what do you say? The feelings are like EPMS, but it stands for Electronic Project Management System, which will give you a very, very nice research-oriented approach of how to fill in this form. I took 1 hour just to get my password right. Now, Preeti is saying, can I collaborate with other colleges? No, you cannot collaborate with other colleges for your research, Preeti. You have to be your guide and you have to be part of the same college. If you collaborate with other colleges for research, that is not going to be a part of this study, because you have to get what is called as an Institutional Ethics Committee approval, okay, which earlier used to be called as IERB. Now it is called IEC, so that it feels more knowledgeable. And this approval is to be done from your college, and they will not approve a collaboration with another college. Purushottam Veda Varshini saying, sir, my guide is doctor and hospital, but he's not from college, but he's from our hospital. Can I approach as guide? There is one eligibility: regular full-time faculty member. If he is a regular full-time faculty member working in the same college, then can be enrolled as the guide. So you have to find out whether he's a full-time faculty member of that. Sir, we have to do research first and then apply. So the application process has multiple, stages over here, and I will just make it a little easier to show you the process. Okay, so there are 3 phases: part 1, part 2, part 3. Okay, each one has to be done in your summer holidays between first year to second year to third year. Okay, and third year to final year. So what you do in first one is only do concept development. So just for concept note, that means now you will only need to tell what is the concept idea that you have, but then the detailed concept note, which means like a research proposal. Who will be the inclusion criteria? Who will be the exclusion criteria? What is your study hypothesis? How you're going to do the research and why you're going to do the research is what you have to develop in the first 2 months, for which you get 15,000 after this is accepted. Then you will do the execution of that study. You will do data collection. Okay, you will do data collection. And when you do data collection, you submit the data, you will get the other 15,000. And then at the end, you will do analysis and you will submit a report. If the report is accepted, you will get 30,000. So the detailing you will have to do only after selection. But for selection, Systema, you will need to tell what is it that you are going to work on. Okay, what is it that what is your study idea? What is the hypothesis? What are you trying to prove? You will have to put that. Swati saying, sir, after my first MBBS exams, can I apply? Yes, first year and second year students can apply. Okay, first and second year students can apply for this project. There is for third year, another separate application is there. That is just a single one-time 3-month project for 30,000 rupees. Now, some blood tests required for my research are a bit expensive. Will the stipend be enough? So YG1234, why you have to choose any expensive research? You can choose any research which it does not involve any expenses. Otherwise, you have to choose a research where you know that 60,000 rupees is the coverage that will be given, only subject to acceptance. You can do survey studies, you can do observational studies, you can do case control studies, but you cannot do clinical trials and cohort studies. But all of these, the simpler you keep the study and the more interesting you keep it, select something which does not have or involve too much expenses, that will also get accepted. If blood tests are expensive, then you will be taking a risk and you should be willing to bear it. If they are not able to get through, you do the study and they reject the report, you will not be paid. So you have to keep that into consideration. All right. But it's a very good thing that 2,000 students will be given a stipend and paid research opportunity, which I think is very good. Was not there, in my time, at all. And this is money should not be the reason. The stipend should not be the reason to do research. To get a study done under ICMR and later on publishing it will give you a lot of good prospects if you're looking for jobs or if you're looking to grow your research career in the future. All right. So those are the things. So for 30 minutes, I will be answering any other questions that you have. Otherwise, it is a fairly, simple, approach. You have to go to this DHR website, an ICMR website. You have to go to this portal called DHR EPMS, and then you have to register. Once you register, the portal will come. And when the portal comes, it is asking very specifically 5 sections are there, some basic information, and then something about what study you want to do. They've given many examples of what studies have been approved in the past. Something as simple as how many patients that come into a particular department, do they have certain information? Like I can give you an example. Let's say the number of patients in ENT who know about what is the abnormal level of hearing loss. That can be just a simple interview based study, and it is a awareness cross-sectional study. Neeraj is asking, my mentor is from college, but I want to do research in some other city. Can I? ICMR at the moment does not allow that, because your data collection and reporting has to be done from the guide of that same college. Okay, so your everything will be limited to your guide. Now, if your guide says you can be in another city and you can still do the research, it's fine. But the data collection report should be verified and reviewed by them. So I guess as long as the guide is okay with it, it should be fine. But I think that ICMR may not prioritize that kind of application. They want the college to be involved. They want the guide to be involved. They want the student to be involved in research. But you can try. Okay. They generally also very openly tell that, especially interview and survey based, studies are good to do at this stage. See, you can't really develop anything in 6 months and such low amount of money, and you can't really do any sort of interventional study. So you have to just think of a good clinical question, and then you have to take that clinical question and ask. It can be in any of these fields. So let's see what are the fields or areas that they are asking that you can you can do your study on. Biotechnology, it could be, something that is, biotechnology related, vaccine related. Clinical psychology, how many people are facing stress, how many people are facing maybe different types of, maybe let's say, mild to moderate depression amongst medicos or amongst patients, or what is the kind of, let's say, proportion of students who have ADHD, something like that. You have to think of a good research question which your guide will be able to help. You can do it in, toxicology, side effects of particular drugs. Let's say in the OPD, 100, 200 patients are prescribed a particular drug. You follow up and ask whether they develop any side effects. Geriatrics, age old related. You can look for correlation, whether, what is this saying? Sir, is it like Ramputini? What is Ramputini? I don't know what that is. So, or, good clinical practices. Geriatrics, you can look at the proportion of patients who have bed sores, for example, in home care, or whether they develop any sort of, certain other chronic conditions, debilitating conditions. Good clinical practices is a good area. Oh, sir is like Ramputini. I'm South Indian hero. Oh, okay, okay, okay. Thank you, Masood. Appreciate it. Okay. So good clinic. I thought it was the name of some drug because in medical, no, these kind of drugs are there. Good clinical practices is a good area, like how stressed is a doctor, how many hours does a surgeon operate, what is the stress level in amongst the nurses, duty, work hours. They all come under health informatics. There's this area called health informatics, which is basically data points of running the hospital, running the medical college. You start tabulating a lot of data that you can get over there: time spent, number of patients seen, number of deaths, number of improvements, number of ICU stay, disease incidence, prevalence, all of those kind of things. There's a huge scope in doing things in health informatics. Mental health is, of course, a big area. So I just want to make sure if the idea is a little bit advanced, like using blood tests to compare a particular condition prognosis, that then it can be selected or not. See, this I am not the selecting authority, but looking at the examples, if a study like this has not been frequently done. So if you go on PubMed, okay, so we have a platform called PubMed, okay. Okay, and when you do, you have to put something called as mesh words. Mesh words are basically keywords which, are selecting the particular study. So if you just Google mesh words or go on YouTube and see how mesh words are used for PubMed, you look at your study and see how much of work is there. If you are doing a study where the answer is already well established, then it is less likely that ICMR will approve such a project. But if you find that, yeah, there is a foreign study but not done much in India, we don't know the Indian data on this, then ICMR selecting committee is more likely to select it or not. One thing you should know over here, YG1234, is you can never be sure and then proceed. You have to submit something where there is the highest chance for it to get accepted, and for that it has to be unique, it has to be doable, it has to be less complex. In fact, ICMR in its own communication is saying that they want less complex projects. They don't want to approve a study which they know the student does not have the ability to do. They just want to encourage research. So it has to be a very doable, very achievable study, and it has to come within the budget, and it can be done in the 6-month duration. So if you want to make sure of certain things, then the ICMR studies are not the right place. ICMR people themselves are not sure of anything. Okay, so that is one thing that you have to see. Now, you can also look at operational research. Quality control is one more thing you can look at. Sterilization, biomedical process, all of those kind of things. Stem cell research also there is there. And in terms of the subjects, I see a lot of projects related to mental health and psychiatry have been accepted in the past. Community medicine, disease incidence prevalence have been, accepted a lot in the past. And survey and interview-based questions have been accepted in the past. See, also remember that your institutional ethical committee, your IEC approval itself, in many colleges may take anywhere between 3 to 5 months. Okay, so if it is a complex study, it will not be easy to get that approval. And at least, if not the approval, the IEC submission letter, you have to submit in your application stage, which is now. So at least you have to draft a particular study concept, and you have to submit it, and you have to put that I have submitted to our IERB. That submission letter that it has been submitted, you have to upload in this form. Just to be prepared for this call, I went through the entire application process, just to understand what are the typical challenges one can face and what all is it that you need. Okay, so we have another 10 minutes. Do you have any specific questions? I'll be happy to answer it. Otherwise, this is a very detailed document, and but this part of short-term studentship is just 2 pages. So you can read. 2% of the total medical dental UG seats will be awarded. That is the target that they're saying, and it's not a very bad target. Out of the students interested in research, if 2% is there, there is no fee system creativitas. It is free of cost. In fact, they will pay you if it is accepted. The risk you take is that you submit something, you put your effort into it, and it does not get accepted. They will not pay you any money for your effort. That doesn't result in any outcome. But yeah, if your concept note and your reports get accepted, you will be paid in 3 phases that they mentioned over here. There are 3 phases of payments. The stipend that they will give over here, you can see 1, 2, and 3. All right, you don't have to pay anything to apply. Okay, anything else that you want me to talk or walk you through this? uh, If you have anybody in your college who has previously applied, or any guide who has previously mentored, they get a little bit higher preference. Even mentioned in the ICMR FAQs, they say if the guide has previously mentored, they most likely, support their research. Because see, at the end of the day, what is it that ICMR fears the most, or any government fears the most? That they are spending taxpayer money and nothing is coming out of it. They don't want to support a student and a guide who are just going to apply and really not do anything meaningful from it. Okay, so think from the selection perspective like that. They want somebody who's really interested, and only if you're really interested will you go through this process. It is not at all an easy process just to go through the application. So if you can endure it, I think it's better than giving entrance exams. Even for NEET and NEET PG, I think they should remove entrance exam and make ICMR design an application which is so complex that only those who truly want to become doctors or want to do post graduation will endure and make the submission happen. In no way this is very easy. It is written over here, but when you go through the process, you will learn a lot of new challenges, and then you have to use your research instincts to come out of those challenges. And when you're able to go through all of that research and innovation and submit successfully, you truly deserve to get this research project. Most of the people, I am quite certain, are going to give up in this process. So you have a very good chance of winning this if you endure. Is it worth the time? 15 days before UNIs. According to me, it is definitely worth it, because you don't have too many opportunities at the undergraduate stage where you are getting a government support in terms of money and guidance from your college to do something extra that can add to your CV and add to your research acumen. Okay, I don't think there are many other opportunities. So this, just as much as your marks, or as much as things that are you are giving importance to for your exams, having a good research experience also helps you later on with jobs and other opportunities. And if you get a good study out from this and you publish it, ICMR is a good brand to accomplish. Even if you say I did an ICMR studentship, it has good value. So I definitely think it's worth it. Now, whether it's worth it for you or not is based on the priorities you have and how much time you need to do this and for your other activities. Okay, but it's a definitely a good opportunity, very much appreciated opportunity by the government, to support not only this research. I was just going through, even for thesis and all, we didn't have any support for thesis, for fellowships. A lot of nice projects ICMR is doing, and it's very positive sign for Indian healthcare, that undergraduates are getting a chance to do some research. Sir, my NEET score is 643. Can I apply for this? Anirudh, nowhere is a NEET cutoff there, for this. But you have to be in a medical college. So I don't know if once you get into the medical college and you are in first year, because your guide has to be from the medical college, you can apply for this. If you are not in a medical college yet, then you can, this program is not for you. It is only for students who are already inside, got their admission inside medical college, and they are either in their first year या second year. तो वही लोग apply कर सकते हैं. Okay. Um, Anything else, guys? Last 5 minutes. Any burning, pressing questions that you have related to this? I'm happy to answer it. But good to see that many of you are interested, and you should be able to get the benefit from this. The previous director of ICMR was a teacher and mentor of mine, Dr. Balram Bhargava, and ICMR has come leaps and bounds, especially after COVID, in the amount of new research that they're cultivating in the country. So very happy to be also a part of many ICMR projects, still ongoing projects as well, and good to see these kind of initiatives that can help students like you get some research knowledge and experience at no cost of your own, at ICMR's cost. And 2000 is a very big number. 2000 is a good number. 2000 medicos, 2% of medicos and dental people get benefited from this particular project. Okay, so I don't see any other new questions. If you have anything, you can ask it now, otherwise we will call it a day. If you just Google, see, that's what the research acumen is, ICMR STS, you will find that it will take you to this platform called DHREPMS, and there you will get the application. You have to register, and it does not let you put your password very easily. One of the tricks I did is Google suggests a password, and that suggested password it accepted, and once you sign in, it gives you the link to this. This link to this document is not there outside. Okay, so this link comes only after you register and you enter the portal, and then this will give you a good step-by-step how to go about it. And even when you go through each bar of the question, there is an information box there which will tell you what you need to fill and what you do not need to fill. Okay, just make a note of the last dates. Okay, so your last date is 15th July for the first and second year, and 25th July for the third year program. Okay, this is for first and second STS. All right, so you have some time, and you can do your research and all of that. Okay, so you can also, I think since there's a lot on health informatics, one of the ideas that I was suggesting, if any use of AI or chat GTPs in this kind of research, if you include that, it will definitely excite, because it's unlikely that AI and chat GTP related research themes have been done in the past, because there's something of recent development. So that is a suggestion I can make, where you can use certain AI platforms to give you health information, and you can check and validate it with real life, and see whether it is got some basis or not. Certain things like this, good research questions, where ICMR wants to know the steady answer, will be good. Anything related to the national programs, ICMR is aligned. So if any student or any college is doing any project related to the national programs, and you can search on the internet what are the current national programs in India, blindness, deafness, tuberculosis, influenza or respiratory diseases, leprosy, whatever it is, malaria, dengue, anything aligned with it, or telemedicine, those kind of things, are the areas where I think there is a lot of potential. Okay, I don't see any new questions, so I'm going to sign out. If you have any questions after this, you can always put it in the comment section of this video, and I will be checking it later today, and I will answer any questions that are left unanswered in the comment section if you leave those questions out there. Okay, so signing out. Hope this was useful. Dr. Jagadish Chaturvedi, take care. Bye bye.